that's not really significant, I don't know what is. But anyway, so again, intensity and duration. Now you put it all together, okay, diabetes, high blood pressure, lack of exercise, overweight, things like that, it all adds up. It all adds up. Hormone replacement therapy, I only say a couple of things. It's been thought that it may be beneficial for heart disease and things like that. However, there was concerns about a study that was done as far as blood clotting of pulmonary emboli as a blood clot to the lung. And actually, probably it's more important to treat the symptoms of menopause rather than to reduce your risk of heart disease. There are a lot of, all those other things that we talked about are much, probably more important. Now, over-the-counter nutritional supplements, we spend tons and tons and tons and tons of money on, okay? And the question is, what is the benefit? Okay, what is the proven benefit? And many times, when you hear these people talking about this is good for this, they're really endorsements. There's no real evidence in 90% of these over-the-counter things. As a matter of fact, if you go into any health food store, if you go into the drugstore, anything, a pharmacy, whatever, go to the aisle where there are all these nutritional supplements. Go to every one of them and look on the back and what it says it's good for. And you know what it says it's good for? Nutritional supplement. It doesn't say reduce your risk of heart attack by 30%. Or reduce your blood pressure, things like that. It's a nutritional supplement. Now, next. So, and the cost of it is tremendous. And here's some of the things that may be beneficial, okay? But again, there's some controversy about it and stuff like that. So just be careful of what you're adding, because not only what you're adding may not be ineffective, but it may be affecting the efficacy of what your other medications are that are helping you. Okay, so just be careful about nutritional supplements. Make sure there's good data to show that they are beneficial. And we do sometimes recommend them for certain circumstances, but I think that you should always, always, always give your physician that information that, oh, doc, I'm taking this, it's very good. And it may be fine, but you have to be careful about what you're taking for. Okay, so anybody who wants to learn about more heart disease in women, the American Heart Association has an initiative, as you know, Go Red, which comes about every February around Valentine's Day. You can go to the American Heart Association website, just go Red for Women, and get all the information you want. Thank you very much. Any questions? Any questions? No. Yes?
Is there any such thing as low blood pressure? Well, what would be the danger there?
Low blood pressure?
Right.
Okay. Low blood pressure is only significant if it's symptomatic. Because people who are well conditioned, people who have our medications, other medications besides blood pressure medications can reduce, for effect in men, sometimes medication to prostate will reduce their blood pressure. So if blood pressure is low and it's symptomatic, it becomes a concern and requires attention. Are you going to have questions later? Or? Well, yes, okay. Okay, so save your questions. Later?
Yeah, let's do it.
Hi, good morning. Good morning, everyone. My name is Adit David. I'm the Director of Gynecology at Staten Island Hospital. And I will give you a short presentation on gynecological cancers, screening and prevention. Try to make it basic. I don't want to go too much into medicine. I want to keep it for the lay people. Hopefully I won't say anything you didn't understand. The first slide I have here, which actually Dr. Constantino spoke about earlier, it's kind of small, a lot of colors. If you look at the leading cause of death total, it's heart disease. So what Dr. Constantino spoke about is very important. When I see patients, women who are seeing the gynecologist, the first thing I tell them, did you go and see your medical doctor or cardiologist? Did you have your cholesterol checked? I check their blood pressure in my office, and if it's elevated, they immediately go to the medical doctor for treatment. And it's very, very important. And again, women are not being treated enough for cardiovascular disease, but Dr. Constantino just spoke about it, so I will not continue. Wait, go back one. Back. Okay, but the second one is malignant neoplasms, or the second red. Okay, and that's what I'm going to talk about today. And you can actually see it's broken up by age groups. And as you get older, malignant neoplasms are up there. When you're younger, unintentional injury is the most important thing you need to look at. So anyone who's under 40, wear your seatbelt, okay? Next slide, please. Okay, and if you look at the probability of developing cancer, this is from the American Cancer Society. Every woman has a 1 in 3 chance of developing cancer in her lifetime. Pretty scary, okay? With breast being the top cancer, I think Coomer will talk about that in a second. What I'm going to be talking about is the ones in red. Uterine corpus, which is uterine cancer, ovarian cancer, and cervical cancer. So these are the incidents. You're at in your lifetime, you'll have about a 1 in 40 chance of developing uterine cancer. You'll have about a 1 in 72 chance of developing ovarian cancer, and you'll have about a 1 in 150 chance of developing cervical cancer. Okay, next slide. Okay, this is again, if you look at men and women, and the likelihood of different cancers. Again, breast is at the top, and you see uterine cancer, ovarian cancer, and luckily cervical cancer, because of pap smear screening, which we'll talk about later, has significantly reduced cervical cancer. Prior to pap smears, cervical cancer used to be probably the #1 gynecological cancer that caused death in the world. Next slide, please. Now the good news is that when you get cancer, you don't die from it. Most of the time, you actually do well, depending on what type of cancer it is. And actually, even though uterine cancer is more common than ovarian cancer, it's rare that you'll die from uterine cancer because it's highly treatable. Of course, and ovarian cancer, unfortunately, you have more of a chance of dying from it. The earlier we catch it, the better it is, and the more likely you are to survive. Next slide. So first, let's talk about endometrial cancer. Endometrial cancer is a cancer that forms in the lining of the uterus, the inside of the uterus. And like I said earlier, it's the most common gynecological cancer in the United States. Again, I said this earlier, about 2 or 3 women out of 100 will develop this cancer in their lifetime. And it usually occurs in women at about age 60. But it can happen to any woman. But the older you are, the more likely you are to get it. Okay, this is a diagram of the female reproductive tract, and you can see the lining of the uterus, that's the endometrium. Outside the endometrium is the actual uterine muscle. That can also develop into cancer, although that's more rare. You see the ovaries there and the fallopian tubes, and the cervix. So we're going to talk about the endometrium, we're going to talk about the cervix and the ovaries. Next slide. Okay, so whenever we're talking about cancer, wherever we're talking about any type of disease, it's very important for us to know what the risk factors are, because there are certain risk factors that we can change. Like Dr. Constantino said, age, we can't do anything about that, but smoking, obesity, we can definitely do something about that. Some easier than others, some things are easier change than others. So again, obesity for endometrial cancer is a huge risk factor. Women who are obese are 10 times more likely to develop endometrial cancer. And we're having a terrible time in the United States with obesity. It's getting worse and worse every year. And New York is one of the more fatter states, if you look at all the states combined. I think the best state, I saw a slide a couple of months ago, is Colorado. So the thinnest people live in Colorado. But if you're obese, that increases your chance of endometrial cancer. Why? Because fat cells produce estrogen, and estrogen can potentially cause endometrial cancer. Having irregular periods can potentially increase your risk. Never having a baby can increase your risk, because having babies are actually protective against endometrial cancer. If you have history of infertility, that increases your risk. Having early periods, starting earlier than age 12, or finishing your periods, menopause late, that increases your risk. Personal history of ovarian or colon cancer increases your risk. There are certain genes that we'll probably talk about later. Tamoxifen use. If you have breast cancer and you were given tamoxifen, tamoxifen is an estrogen-like hormone that is very good in treating and preventing breast cancer, but it can increase your risk of endometrial cancer.